Next, we will have and feature an activist that has been very involved with um, trying to awaken the United States and, well, hopefully the world to the needs of long COVID. And Paul Hennessy has is an activist and has brought his marketing, production, and skills into this world that resists change. Unfortunately, we'll have only 15 minutes with Paul and there won't be a QA, but I will signal Paul, you, when we have 2 minutes left, and I'll ask you, let me give you the, open you up here, unmute, and move to the stage. Um, Paul, are you there?
Yeah, hi, can you hear me?
Great, I can, thank you. And uh, can you tell us what you've been doing? I think you were involved with an important event in Washington in March. Maybe you can tell us about that and what you were involved with.
Yeah, I've got a statement prepared here, which does touch on that. Thank you for the organizers of Unite to Fight for inviting me to speak. Um, my name is Paul Hennessy. I consider myself an ally in the fight against long COVID. I helped plan the demonstration LCDC, which took place in Washington, D.C. last March. What we achieved was remarkable, creating a large physical demonstration of people with long COVID and allies speaking their truth about the disease. We stood in direct opposition to our government's narrative of the pandemic being over. It was a huge success and raised a ton of awareness, but we all knew the work wouldn't stop with just one event. Um, until the pandemic hit, I was naive to the disabled experience and the idea of community care. I lived my entire life asleep, boxed in, unaware of the privilege I had. As COVID raged on, I saw people I know and love die or become disabled by it. I connected with others who were disabled by long COVID, and by extension, learned more and more about the dangers and discrimination disabled individuals face. The more I listened and sought out stories, the more I learned about the long-term effects of a SARS-CoV-2 infection. Things my government and the WHO wasn't admitting, such as viral persistent and the neurological destruction. Learning about the risks associated with COVID made me want to retreat. Things seemed fine, I told myself, but I owed it to those who are suffering to keep learning and serving others who are too sick to advocate for themselves. And the more I learned, the more I realized the mild narrative I was telling myself was just convenient denialism that ignored suffering, nuances, and rises of long-term issues caused by COVID. For fans of the TV show Breaking Bad, there's a line in the first episode where Walter White states, "I am awake." To the doctors and general public who have hit the snooze button on long COVID, it's time to stop pretending that the pandemic is over. It's time to wake up and mask up. It's time to face these hard truths rather than run from them. It's time for systemic change. If you understand the severity of long COVID, you need to vouch for patience. It seems that the general public no longer cares about COVID because they're more focused on moving on with their lives rather than taking time to learn about the ongoing long-term effects. The disabled experience doesn't have that convenience. Where did this laissez-faire attitude come from? Well, it starts from the top. Leaders like the WHO and the CDC here in America laid out a playbook to effectively downplay this horrific virus and manufacture an end to the pandemic so as not to disrupt our capitalistic society. During 2020, we woke up for a moment and saw possibilities to overhaul systemic issues that were ingrained with us, with solutions that now seem possible, like universal health care and income, increased disability, equitable treatments, remote work, and community care. That mindset was put to an end thanks to the powers that be. And soon it was back to work and back to the status quo. And many of us took those lies without question and told ourselves vaccinations would solve everything and that there's no longer risk. I didn't learn the truth about SARS-CoV-2 from any institution. It took listening to patient advocates. It's deplorable to think that I learned about the airborne nature of SARS-CoV-2, not from any health professional, but from Twitter, how it lingers in the air like smoke for hours. This stood in direct opposition to what WHO leaders like Dr. Tedros, Dr. Maria Van Kerkhove, and Dr. Mike Ryan were saying. The droplet theory was a lie fed to us by them that resulted in millions of death and disability around the world because they wanted to protect corporate interests. Now, the WHO and the CDC here in America talk about victories over COVID as if it's not still killing and disabling people across the globe. Make no mistake, they need to be held accountable for this. The similarities between HIV and SARS-2 are impossible to ignore, but leaders and public health organizations across the world are doing a damn good job at trying. In fact, the same playbook for HIV denialism is now being used for SARS-2, and blood donations are occurring without any testing for long COVID, in the same way HIV-positive individuals used to be able to donate blood. Mass reinfection of SARS-CoV-2 is resulting in damaged immune systems, which lead to opportunistic infections from tuberculosis, measles, H5N1, fungal infections, and more. COVID causes brain damage, stroke, dementia, blood clots, Parkinson's, bone marrow loss, kidney and liver failure, T-cell loss, rapid aging, and more. It can activate autoimmune diseases. Children are developing long COVID and long-term issues like diabetes from unmitigated spread in school. The leading theory of this is viral persistence, which can affect the cardiovascular system, brain, nervous system, bone marrow, and every major organ. COVID causes inflammation and dysregulated immune systems, allowing for cancer to build. Viral reservoirs in the bone marrow, heart, and brain are not being cleared. Ongoing viral replication and tunneling nanotubes are occurring with each infection, despite experts insisting it was impossible. This can happen to vaccinated and unvaccinated people alike. It can happen to you, even if you're not high risk. Rather than seeing the parallels to HIV and repurposing antivirals, the NIH in my country has opted for vague studies which have gone nowhere. And that criminal template has been followed by other leaders as well, who pat themselves on the back while a growing number of people across the world deteriorate. For better or for worse, America has influence over public health policies in the countries which led them to this dangerous let it rip approach. And that requires constant and immediate pressure from the public to turn this around immediately. So on that note, I'd like to address the general public who have decided to believe lies told to us by the politicians and health officials like the WHO. Governments and the WHO won't save us. It's your responsibility to push back and demand more. It's time for all of us to wake up, mask up, and act up. In my own country, many of the same senators who held the long COVID hearing also voted to ban mask mandates on public transit, cut COVID funding, supported reduced isolation guidelines made up by the CDC, cut science funding, and have not passed any clean air laws or long COVID funding. There is one extremely underfunded long COVID proposal being discussed here in the US, which essentially throws pennies at this massive problem and gives it to the NIH, who has already spent years wasting time and money on studies that have gone nowhere. This is, of course, a way to say they're doing something while actually accomplishing nothing. Let's push back against this. There's so many ways to get involved. It's overwhelming, but if you seek out those with long COVID, you'll learn ways to advocate on an individual level. I've learned to advocate for things through compassion and self-education. Your compassion is needed too. We have to face these hard truths, that COVID is much more dangerous than what we're being told. We need to advocate for prevention tools such as high-quality respirators and clean air. We need better vaccinations that are actually sterilizing, both intranasal, nasal, and injected. We need ways to keep them affordable and be able to provide unpatented vaccines and antiviral combinations to third world countries. We should all be advocates because long COVID is coming for all of us, not just the vulnerable or unvaccinated. We're stronger together. But let's first start with prevention because we need a layered approach to protection. We have to stop reinfection and disease progression simultaneously. There's nowhere in the world we can safely exist, hardly, because anywhere has invested, nearly nowhere is invested in clean air protections. The WHO and CDC hardly mention it. Long COVID treatments without airborne protection is like HIV treatments without encouraging condom use. Doesn't make sense. Right now, you can be a clean indoor air advocate. You can ask your place of employment or school to install air filters, UV lights, CO2 monitors. You can demand better air filtration tools in businesses. You can push for clean air and masking in schools, medical centers, public transit, public buildings, restaurants, venues, and all forced congregate settings. Get creative. Organize a call into different businesses. Leave bad reviews. Go to local and state governments to ask for clean air laws. Organize mass rallies with long COVID activists. It takes persistence, but I've seen results. We need to demand more funding from our governments. For example, here in America, the appropriate amount of funding to address this crisis would be a minimum of $28 billion annually. Anything less will fall short. Invest in healing humanity, and those investments will transform medicine. Start a clean air club. Highlight and support businesses that are COVID safe. Host mask required and clean air events. You'll be surprised how successful they can be. Every government must provide easier pathways to disability for those with long COVID and ME. Where are the social services? Few long haulers have received direct support from their communities and government and are struggling financially because they can't work. It's time to demand they compensate everyone who's been needlessly disabled by the pandemic with direct aid. We need to advocate for viral load tests and advanced full body imaging tests, while also understanding that long COVID has nuances that can't always be quantified. We need repurposed and novel antivirals, both oral and infusions. We especially need to find combination antiviral therapies that can clear bone marrow and brain of persistent virus, as well as autoimmune treatments. We don't need vague treatments that only suppress symptoms. We need cures yesterday, because 5 years with no approved treatments is unacceptable. Watching the CDC downplay the long-term effects and reduce isolation times is like watching a firefighter give us a bucket of water and telling us to return to a building that's on fire.
Paul, 2 minutes. If you
got
can wrap it up and tell us how we can find you and help.
Of course. Yeah, it's less about finding me and, finding doctors, scientists, philanthropists, and government officials to listen and attack long COVID on every possible angle and elevate the stories of those with long COVID. We need donations to places like PolyBio. We need aerosol experts to push for better ventilation guidelines. We need doctors to advocate for patients. We need to elevate long COVID activists. We need journalists who accurately report on ongoing dangers of COVID and viral persistence. We need better PCR tests and vaccines. We need lawyers to sue hospitals and workplaces for allowing infection to occur. We need coordinated efforts to combat and prevent mass infection. And we need open source solutions that can be shared globally. And only then will we end the cosplay of normality and create a more healthy, equitable world. If we don't act now, we're in for a global reckoning that's already begun. So on that, we must never thank the government or public health when they give us breadcrumbs, because their ableist policies have created this mess. Instead, spend your effort demanding more.
Paul, you've been a very, very articulate responder to these problems that millions of us feel. And I think we're very grateful that you are articulating this on behalf of so many that are suffering. So thank you so much. And thank you for taking the time to be with us today.
Thank you.
Have a good day. Bye-bye.